The head of the FDA is speaking out against compounded semaglutide and other fake weight loss drugs. Ozempic and Mounjaro have been around for decades, approved to treat diabetes. Recently, they've exploded in popularity because of their amazing ability to control blood sugar levels and cause weight loss in patients, along with the potential of decreasing the risk for heart disease. Within the last year, both Ozempic and Mounjaro have been FDA approved for weight loss under the brand names of Wegovy and Zepbound. The explosion in popularity of these medications has led to nationwide shortages, prompting compounding pharmacies to take matters into their own hands by making their own versions of these medications for sale to providers. Now, there's nothing wrong with making compounded medications when there's a true shortage, and the FDA is actually okay with this. The problem is when these medications are compounded without proper controls and under the appropriate conditions. When Ozempic and Mounjaro were created by their respective manufacturers, they underwent rigorous clinical studies to show their effectiveness and their safety. When compounding pharmacies make these medications, they often combine them with other medications and ingredients, but they don't do any studies to see whether this combination is safe or how much of the active ingredient is actually in their product. And when something is this popular, the bad actors also jump on the bandwagon. There have been reports of these medications being made in contaminated conditions, which can lead to devastating complications. The fact that these compounded versions are extremely cheap when compared to the brand names has made this very attractive to patients. And I know that there are several compounding pharmacies that are reputable and probably manufacture good product. But how are you and your provider supposed to know which ones those are for sure? And is it worth the risk? Now, every medication has risks, complications, and side effects associated with them. But most of the patients I've come across that have experienced severe complications from weight loss medications have been with the compounded versions. And the manufacturers of Ozempic and Mounjaro are actually going after these compounding pharmacies and providers who are offering these compounded versions. I recently started a weight loss program where we only use brand name medications under my direct supervision. And if you're interested in starting your weight loss journey with these medications, I suggest you find a provider who does the same. What's your experience been with these medications? Share it with me.